Hi Nigel, today we're going to talk about scabby mouth. Can you tell me what it is?
Yes, so scabby mouth has got several names. It's called contagious pustular dermatitis, and it's a virus infection. It's of the pox family, and I don't know all the technical details, but the pox family, and it causes primarily skin problems for us, mainly in sheep and goats.
And what's the distribution of it in Australia?
Pretty widespread, although we don't have very much here on the northern tablelands. It's an interesting disease because you can vaccinate against it, but the vaccine is a live virus vaccine, which means that by vaccinating animals, you're creating scabs on the young lambs, which is where we mainly use it, which then introduces the virus into the environment. So a lot of places may have the occasional outbreak, but if there's good immunity in the flock, then you don't get many clinical signs. But it's not in all areas, and I, for one, don't know exactly why not. One looks at things like nutritional status and the ground, etc.
Nigel, you mentioned that sheep get scabby mouth. Are there other species that are affected?
Look, it is primarily the small ruminant, the sheep and the goat that will get it, but it's not unknown in some of these others. But we don't, if we've got sheep and cattle grazing together, that they've both got it. It's not a worry at all for the cattle or for horses.
You mentioned that it's controlled by a vaccine. Are there any other management methods that people can use to prevent it in their flocks?
Well, nowadays in agriculture, we should be looking at not even acquiring sheep to bring onto the flock that may be carrying the virus. So we always recommend checking that the property of origin of bought-in ewes, rams, etc., have not had it. If you don't want to get it at all, and that's the best method. It's found all over the world, and that it has caused problems in world trade, which is why I think we'll come back to that bit later. But for individuals, if you know that you've got it, you've really got to be thinking hard about what the effects are going to be on your property. And if you get it all the time, as some properties do, it never gets very bad, so it's never a major commercial loss. It just causes a bit of aggravation.
With the vaccine being a live vaccine, is there an issue with needle stick injuries of sheep handlers?
There is, very much so, and because the vaccine is actually caused by scratching usually the inside of the thigh of a young lamb within only a few days of birth, as soon as you can, really, and because you're scratching the skin to break the skin to let the vaccine into the skin, where it causes a mild form of the disease, then the handlers are at risk either of scratching themselves, or in the rough and tumble you've got wounds on yourself. So when you're handling the lamb to take it out of a cradle, for instance, you could inadvertently get it into a scratch. Immunity in people, speaking from personal experience, is very good once you've had it, but it's that first time that's always a concerning issue.
You mentioned it in people and that you've had it. What symptoms do you experience?
Well, pretty typically it's a skin lesion. I remember specifically the time that I caught it, because it was in the UK and I was in a mixed practice, and the other two vets in the practice said, could I come in and look at this young pet lamb, and did I know what it was? And I remember putting my hand over the top of the head to to hold the head back to have a look, not knowing what I was going to see, and could see this lesion on the corner of the lower jaw round an erupting tooth. And I just said, oh, straight away, and I think in those days I was calling it ORF because that's the English name. And I remember going straight to the sink and washing my hands because I hadn't put gloves on, and washed my hands straight away. But then about 2-3 weeks later, right in the corner of the nail of this left thumb, there was a lesion started, and I thought nothing of it. You tend to get those little scratches in the corner, but it grew and grew and started spreading around. So I went to the GP and said, look, I've got this lesion here. I'm just worried it's going to spread it, blah, 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 blah. But he didn't know what it was, and I wasn't totally aware until I told him that I'd handled this animal with ORF, and I thought it might be that, which is why I was keeping it covered. So they're lesions wherever there's been a break in the skin, and that depends on where you touch. So you can get it pretty much anywhere on the body that it's there. I don't believe from a medical point of view that you get internal lesions with it. I may be wrong. I don't know. You guys know better than I do. But it's usually a skin thing, and so you could touch the infected one and then scratch your face, create a minor little, head off a pimple or something like that. You could get it on your arms, or gentlemen could go behind a tree and to empty their bladder and catch it that way.
Okay, and the life cycle of scabby mouth, how does that?
Yes, so it's pretty straightforward. You've got the virus, like a lot of these pox viruses, they're pretty long-lived. They're in the scab, which survives, drops off, gets knocked off the skin lesion, and drops to the ground, and can be rubbed off in wooden fence posts, gates, stay hidden away from the dark, especially a bit of a lean-to. And then when a susceptible animal comes along and it gets these virals into the wound, then you get this typical pox lesion, which starts off as a little vesicle and then crusts over as you get secondary infection.
Right. And you alluded to an impact on world trade. How does this disease affect world trade in livestock?
Yeah, very, very interesting. So if you've got a mild infection because your animals have got some resistance, a typical lesion could be literally a few scabs at the corner of the mouth. And the doesn't seem to affect them. If you get really severe animals that are eating thistles and dry grass, etc., you can get a lot of damage around the mouth, and then it can really thicken up around the point of the jaw. But in a world trade situation, people are always looking for a mechanism to knock prices down, and live exports to the Middle East especially. A few years ago, I was involved with that. They had problems because although the disease exists in the Middle East, some of those countries put a blockage on getting livestock arriving from Australia that have got scabby mouth.
And is the concern there based on its transmission to sheep in those countries or to people in those countries?
Yes.
Okay.
I can't speak for the reasons why they make that decision. It's known to be a zoonosis. I've worked in these countries. I've seen the disease rampant in their native flocks. So I ask myself why, when normal veterinary requirement for intertrade is that if you don't have a disease in your own country or if you have a disease in your own country and you don't have a formal mechanism to try and control it, so a legal government program to try and control its spread for whatever reason, then you should not be allowed to reject imports of animals that have got that disease, because it's not an even playing field.
When you had scabby mouth, how was it treated?
Well, that's a very nice segue into the next part of our discussion, because the doctor said, oh, this will treat it. And he said, this is a new antifungal antibiotic thing that we'll give you. And he gave it to me and it didn't work. And I got secondary infections, and the infections that I got into it were a fungus. And the fungus, because it was at the corner of that nail, got into the nail bed. And for years, nothing that they could do for me in Cornwall could cure it. So I thought, oh, well, that's it. I'm going to be left with a nail that won't grow. And I got used to it. But then I was working in Jubail, which is in the eastern part of Saudi Arabia, a few years later. And I had to go to the doctor for a vaccine or some such. And I we had a chat, and he said, look at that nail, you've got a fungus infection there. He said, I said, yeah. I said, they've tried all sorts of things, both painted on it and inside, nothing's worked. He said, I've got the stuff for you. And he gave me some Castellani's paint, which is a vivid purpley coloured thing. You can still get it. And it's a paint this on. Wow, it cured it a treat. I can't remember what the active ingredient of it is, but I remember the name because one of my colleagues at uni, he got a ringworm of the groin, and they gave him Castellani's paint to paint on it. And he spilt the pot over the carpet. So there was this violent purple on the carpet, I remember, which is why it stuck in my mind. But it worked. That's
the main thing. Is there anything else you'd like to share about scabby mouth before we move on to ringworm?
Look, I think from a veterinary perspective, the problems we get with it can be lesions around the mouth that can be so severe that lambs will fail to suckle their mother because it's so painful. Mothers can get it on the teats, so they won't let the lambs suckle. We can get it into, as I mentioned, pustules on the jaw, which again is a real problem, and it drags them down. But they can also get it on the feet, and it makes them lame, and then you get secondary infection. So the signs are all related to where the infections are, and it's usually self-limiting. I think even in people, but in mammals in general, just so long as you don't get the secondaries in place.